insurance when it first became available, and she's been enrolled ever since, paying about $100 a month. This past year, that coverage saved her life. I'll let Lana share her story.
Hi, I'm Lana Rubright. My husband and I have been self-employed since the 1980s. We've been in Charlotte here, and we run a construction business. And through that time, because we were a very small business, and most of the time it was handmade, so that's small, we had to carry our own insurance policies. And over the years, the policies continually went up and up. And before the housing crash in 2008, our insurance was getting ready to go to $1,500 a month for catastrophic insurance, which, if you don't know, you better not have a pre-existing condition, and you don't want to go to the doctor because they're not going to cover anything for you. But they will raise your rates. Be sure of that. In 2009, we were close to losing our house. And we were trying to plug up the holes to get through the housing crunch. Something had to give, and we dropped our insurance, thinking that we would pick it back up when things were going better. We went 3 to 4 years without insurance. When the ACA became available, we were ready to apply. My husband and I were healthy. We have never been on long-term medications. And my sister had been diagnosed with colon cancer a few years before this. And I realized the importance of regular screenings for cancer. Since that time that we've been enrolled, I've taken advantage of annual checkups and preventative care. Last June, around my birthday, I went in for a mammogram. And they detected stage 2B ductal carcinoma, which is breast cancer. I had surgery. They removed the tumor. They actually had to do 2 surgeries because they didn't get the margins well. And for the last 12 weeks, I've been going through chemo. That's why I have this lovely hat on. Last Wednesday was my last chemo, which I wouldn't have been able to get without Obamacare. Having Obamacare has given us peace of mind over the last 6 months. To not feel like you're bankrupting your family to pay for medical bills is a huge relief. In the new year, I will be going through radiation treatments. I will be on Herceptin for the next 9 months. And after that, I will be taking a pill form. And it used to be for 5 years, and now they're saying maybe 10 years for it. So I don't even know the cost of that at this point. I feel like no one deserves to be sick. You know, we don't ask to get sick. You can't work and contribute to society the way you can when you are healthy. There's a lot of things that go into being unemployed or having an illness. If you don't have your health, you can't be a good employee and you can't be a good business owner. We got our butts kicked when the recession happened. And now we're working class, and that's okay. But we got squeezed out of the middle class because of things out of our control, because of reckless decisions made by other people. We have a steady income coming in, and slowly we're rebuilding our business and our home. Since the election, I've had a lot of sleepless nights worrying that I won't be able to finish my treatments. For the rest of my life, I'm going to be getting scans and checks, and hopefully they will all be negative. How can I wake up each day and go to work when I feel like every dime that I make is going to pay for maybe 1 scan or the medication that I'm going to need? Cancer is overwhelming. You do what you can each day. Having a health insurance makes a difference because it lends stability to my life. It's a safety net. Sorry, pages sticking together. I hope in sharing my story is enough for people to see the need for health insurance. Just the preventative care alone is so important. Regular screenings are a huge part of healthy living. It's never a good time to get sick. The emotional toll is high enough, and the cost shouldn't be the final blow. But at some point, most people will deal with illness of some kind, or a tragedy. I'm so grateful to President Obama and all the people who saw the need for making affordable health care available to everyone is a top priority. And if you don't have coverage, go sign up.